Perfect. Well, we are at 1 o'clock. I know a number of folks will probably squeak in a few minutes past because that's just the way it is, and that will be great. But let's begin on time for everybody who has arrived on time. So thank you everyone for joining us for our Move and Connect webinar today, focused on the benefits of physical activity for those living with arthritis. I'm Sarah Lucina. I'm the Executive Director of the Active Aging Society and a member of the Active Aging Research Team at UBC. And together we bring you Choose to Move, a program that many of you who are joining us on this webinar today have benefited from. A special thank you to our partners at the BC Ministry of Health for supporting the scale up of Choose to Move, and of course to our 95 plus community-based partners who bring Choose to Move to communities across BC. And as a small gesture on my own personal reconciliation journey, I want to acknowledge that I'm joining you from the unceded and ancestral lands of the Coast Salish nations in what's commonly known as Vancouver. And I know many of you are joining from across the province on traditional and unceded lands of many other Indigenous nations. So I welcome you to say hello in the chat and share the lands upon which you are joining us from. Also, you'll notice that Hanson, our communications manager, has put up in the chat that nobody's videos are on today except for those who are presenting. So you are not being recorded, or your video is not being recorded, but this webinar is being recorded, and it will be available for you on our website later this week for sharing and for referring back to. All of the resources that are presented today, as well as the slides, are going to be shared after the webinar. So you don't have to scribble anything down in a hurried way. Just sit back, listen, and be ready to move as well, because we do have a movement break. So without further ado, I want to introduce Dr. Marie Westby. She is a clinical associate professor with the Vancouver Coastal Health Research Institute and a researcher with the Mary Pack Arthritis program. And so she'll be speaking about the benefits of physical activity when living with arthritis. And then one of our own Choose to Move activity coaches, as well as the co-founder of Quantum Care, Etta Tran, is here to take us through a movement break. So we're going to have about 15 or 20 minutes of slides and presentation from Marie, and then about a 5 to 10 minute movement break with Etta, and then back to some slides and some Q&A. Again, just a technical housekeeping, those resources are going to be shared. Your video is not being recorded. If you do have any questions that you want to pose throughout the webinar, you can post them in the chat and I'll try and pull them out. And we did curate a list of questions from those who submitted them in advance. So without further ado, I'm going to turn it over to Marie. You all set, Marie?
Yeah, it was 1 second. Just going to share here.
Sounds great. And thank you again for being with us today.
Okay, that should capture hopefully all of the slides. Sorry about that. You think you've mastered Zoom. So yes, welcome everybody. It's a privilege to be able to talk to you today about something that's I'm very passionate about, and that is arthritis and how important it is to stay active. And I've titled this Arthritis, All the More Reason to Move, because in my 30 plus years experience working at the Arthritis Center, I've often found patients with arthritis, as well as unfortunately sometimes health professionals, actually discourage or give mixed messages about the importance of movement when you're living with arthritis. And so I just want to go over some of the benefits and why movement is so critical when living with arthritis. So I'm going to talk about some common types of arthritis, discuss some of the benefits of movement and exercise, as well as specific exercise recommendations for people living with arthritis. Talk a little bit about breaking down the barriers. There's lots of good excuses and reasons and challenges to being physically active with arthritis. So we'll take a look at a few of those, and then finish up with some community or web-based exercise resources in case you're interested in learning a bit more. So this is a common way for us to describe or sort of demonstrate the different types of arthritis. And I've picked 3 types of arthritis today that we see a lot in the Mary Park Arthritis Center, and also give you a good idea, and I hopefully resonate with some of you on the webinar today. The first one is osteoarthritis, and it's definitely the most common form of arthritis. About 1 in 7 Canadians are living with arthritis, and over the age of 50, and even more so over the age of 60, 65, that number goes up considerably. You can see from these are called homunculus or homunculi, and these are a nice way to show which joints are affected by different types of arthritis. So in this first one here, osteoarthritis, the main joints or the most commonly affected joints are the hips and the knees, the big toe, the base of your thumb, and the small fingers at the end, the small joints at the end of your fingers, and the neck and low back can also be involved. Now, then take a look at the middle picture. That's rheumatoid arthritis. And rheumatoid arthritis, I'll tell you a little more about, but it only affects about 1 in 100 Canadians. And you can see here, there's a very symmetrical distribution, and it affects mostly the smaller joints. So now we see it affecting most of the joints of the toe and the ankle, as well as slightly different joints of the hand, the wrist and the elbow. And the only part of the back that rheumatoid arthritis tends to affect is the neck. And then switching off to the far right side, this is an example of how ankylosing spondylitis is also called spondylitis or spondyloarthropathy. There's lots of different names, and it affects about 1 in 1,000 people. So even less common, but still hundreds of people in British Columbia are living with ankylosing spondylitis. And it, as the name suggests, spondy meaning spine and itis meaning inflammation, it affects mostly the spine. So we see that often start in people in their sacroiliac joints, right at the base of the spine where it joins into the pelvis, and it can sort of travel its way up the spine. And if it does involve any of the what we call peripheral joints or joints of the arms and legs, it's typically the shoulders and the hips. So let's look at each of these a little more closely. This is a slide by rheumatologist Dr. Howard Lux, and he did a really nice job of putting together what we used to think was the cause of osteoarthritis, and what we still hear actually sometimes when we read about it. And that is that osteoarthritis is simply a matter of wear and tear on the joints through cumulative use as we get older, or it's a result of direct injury to the joint. But the newer understanding of what osteoarthritis actually involves is actually much more complex than this. It's, yes, wear and tear, cumulative use. Some jobs, occupations, sports, activities can put undue stress and wear and tear on parts of the joint, and they can cause breakdown of it. But we also know it can be associated with metabolic syndrome, which is a cluster of conditions occurring together, things like high blood pressure, high blood sugar, excess body fat around the tummy, lipid abnormalities, which means you have high levels of the bad cholesterol and low levels of the good cholesterol. We also know that obesity itself, especially when carried around the stomach area, can actually mediate or ramp up the amount of inflammation in the body. The cells, the adipocytes, which are the fat cells, can actually release chemicals that actually increase inflammation in the body and can cause a low-level sort of chronic inflammation. We also know that carrying extra weight can put mechanical load on our joints. For every extra 1 pound of weight we carry on our bodies, depending on what activity you're doing, but just with simple walking, that can put 3 pounds of extra weight on your knee. So it's a multiple of 3. So 10 extra pounds means 30 pounds of extra stress on your knee. Now, our joints were designed to take this, but actually, obviously, over time, that extra stress, especially coupled with maybe a background in sports or even an injury, can increase the risk of developing arthritis. So what do we know about osteoarthritis? I'll just adjust that because I think I'm cutting it off a little bit here. We know that about 625,000 adults in BC are living with osteoarthritis right now. But we also know that starting at about age 50, if you have hip or knee osteoarthritis, there's only about a 7 to 12% chance that you will actually need a hip or knee replacement throughout your lifetime. So that means that for the vast majority of people, 85% plus, they will not go on to need a joint replacement. And for them, exercise and physical activity, education with self-management skills, and weight loss, if that's appropriate, are the recommended treatments. This is an example of what we refer to as a stepped care model for osteoarthritis. And this is what I'd love to see everybody who has osteoarthritis be offered as first-line treatment when they have that diagnosis made together with their physician. So at the bottom of this pyramid, recommended for everyone is what we would call primary care or first level care. And again, that's the education with self-management skills, exercise and physical activity, and I'll talk more about that, in weight loss. For some people where that is not enough, or the arthritis is more advanced, or maybe it's more advanced by the time you get a diagnosis, they may need some additional care, and that might be done at a physiotherapy clinic or an outpatient department. They may also need to use medications, have therapies like modalities and more customized exercise programs delivered by clinicians, maybe aids or devices, special footwear or orthotics made by occupational therapists. And then for a few people, they may require specialist or hospital care. And that's things like surgery, injections, cortisone injections, and things like that. But that's for a few people. And what we find in our clinic when clients come in to see us is that not everybody has been recommended that first level of care. And some people even get to the point of being put on a surgical wait list for a hip or knee replacement, and they haven't even done those first two levels of care. So let's take a little bit closer look at rheumatoid arthritis. Rheumatoid arthritis is a systemic autoimmune disease, and it does have some genetic basis. It's not automatically inherited, but it does have a genetic component. And what happens with rheumatoid arthritis is it causes inflammation of the synovial lining, which is this sort of red, angry looking lining. I'm just going to move something in my screen here. It's this red, angry looking lining here, and it becomes inflamed and increases the amount of synovial fluid into the joint. So that becomes a swollen joint. That inflammation then can also affect the capsule. Lost my cursor, which is the green line here, as well as ligaments that support the capsule, the bursa, those little purple areas there, and the underlying bone. So with all that inflammation present in the joint, all the tissues around the joint can be affected. And sometimes that leads to loss of motion, damage to the ends of the joints, and sometimes actually sort of alteration in the positions of the joint. But rheumatoid arthritis is also a systemic illness, so it can involve other systems of the body, such as the eyes, the heart, the lungs, and the skin. So early diagnosis and treatment is key. And fortunately, in the last 10 to 20 years, the medications that have come out for rheumatoid arthritis have been groundbreaking. With the biologic drugs and biosimilars, sort of the generic version of biologic drugs, have been incredibly effective in reducing the inflammation and actually preventing joint damage and inducing remission in people so that they can live with minimal pain and discomfort and not develop some of the deformities and functional limitations that we used to see in the past. For rheumatoid arthritis, regular physical activity is also highly recommended, and it's in an individualized format would be best. And I'll talk a little bit more about what you should look for with that. At the bottom there is just a link if you want to learn a little bit more about rheumatoid arthritis on the Arthritis Society's website. And then spondylitis, again, is a systemic illness, so it affects more than just the bones and the joints. And it's also an autoimmune disease. In this case, it attacks the places where tendons and ligaments attach to bones, and these are called entheses, and it causes enthesitis. So up your spine, you have ligaments attaching or sort of stabilizing each vertebrae to each other, and they run all the way up the spine on the inside and the outside, as well as running up between the little, what we call facet joints, or the joints that go up the side of your spine. They get inflamed. Those ligaments and tendons can become hardened or calcified, as you can see in this picture here. And you can get a very, very stiff spine. That, of course, also affects the vertebrae themselves, the bodies of the vertebrae that your spine is stacked on, and that can affect the bone quality. The diagnosis for spondylitis, unfortunately, is often delayed because it typically presents more commonly in men, which is unusual, as most forms of arthritis affect more women, but very young men, often in their late teens and 20s. And it can often just show up as low back pain, back strain with work or working out or exercising. And it can often go on for years before a physician will look into it more and kind of go, this is unusual. Let's take a little bit closer look and do some more testing. There are, again, newer drugs, similar like rheumatoid arthritis, the biologics. Not as many for ankylosing spondylitis have been approved as rheumatoid arthritis, but they can make a significantly reduce the inflammation and pain and stiffness, and again, try to prevent the stiffening or actual bony fusion of the spine. But again, exercise is the key non-medication related therapy. So what are the benefits of physical activity, specifically for those of you living with arthritis? Just going to move. Okay, there we go. So we know, I'm sure all of us know, and especially for those of you who have participated in the Choose to Move program, the tremendous benefits that regular activity has on our well-being and on our bodies. But specifically for arthritis, the more movement is better. Cartilage, which is at the end of our bones, has no blood supply, has no nerve endings, and has no lymphatics. The only way for it to get its nutrition and oxygen is through the fluid inside the joint, that synovial fluid. Now, that fluid bathes or covers the tops of the joints, but it literally needs to be squished into the cartilage when we bear weight or push against our arms or pull things. And then when we unload the joints, such as we do repeatedly with walking, compression, unloading, that pushes the fluid into the cartilage, and then it releases the fluid out. And that exchange of fluid is how the cartilage maintains its health. So when we don't repeatedly put load on it and move the cartilage or move the joints in different ways throughout the day, we're not bathing the cartilage in the fluid, and it's not getting its necessary nutrition. Exercise also actually reduces pain and disease activity. It was often a concern of clients that I saw with rheumatoid arthritis that if they did more exercise, they were worried that it might actually cause a flare-up or make their pain worse. But there's so much really good research out there now that shows not only does it not make it worse, but it can actually lower overall disease activity and pain. And we know that through doing things like a joint count, where we'll push on the different joints in a very standardized way and see how many of them are inflamed, as well as blood tests. ESR and CRP are two types of blood tests that they do to look at the overall level of inflammation in the body. We also know that for people with arthritis, fatigue is a big issue, especially with systemic illnesses, and regular exercise can actually decrease that fatigue and improve sleep. It's obvious for everybody that regular exercise, especially muscle strengthening exercises, can build up the strength and endurance in the muscle, helps to improve the range of motion and flexibility, so it's just a little easier to move and decreases stiffness. It helps with bone health. Bone too, just like cartilage, needs to be loaded in a cyclic fashion in a repeated in a number of different ways in order to maintain its bone quality and bone density. Having flexible joints and strong muscles helps to obviously improve our day-to-day function. It can also enhance our mood, reduce depression, and prevent a number of other chronic conditions associated with being inactive. And because people with some types of arthritis, including some forms of osteoarthritis, have this underlying chronic low level of inflammation, that can also be a risk factor for other conditions like as heart disease and diabetes. And we know that physical activity can help with those. On the flip side, is sedentary time. And that's why we've made sure we have a movement break during today's talk. Anytime when you're awake and you're not actually purposely lying down to sleep or at night, so you're sitting, you're watching TV, you're watching this webinar, reading a book, that's considered sedentary time. And sedentary time can actually increase our joint pain and stiffness, lower our muscle strength, reduce our contraction speed. So that's the speed at which you can get your muscle to contract quickly if you stumble and you trying to prevent yourself from falling. So it can increase the risk of falls if you don't have good muscle strength and contraction speed. And it has a number of other detrimental effects, almost, as you can see, the opposite of being physically active. But what I've noticed over the years is that when I do have clients come in and tell me about on all these different symptoms they're experiencing, that many of the symptoms that they thought were associated with their arthritis are actually due to inactivity or being too sedentary. And if we're successful in getting them into a physical activity program, sometimes starting in the pool and doing light exercise, some of their arthritis related pain and stiffness and problems start to go away. So we actually know, even though the arthritis hasn't changed, their activity levels have, and that has made a big difference on some of the symptoms they experience. So guidelines, how much activity or exercise should we do? In 2020, Participation Canada, I'm sure a lot of you remember those Participation ads, together with the Canadian Society for Exercise Physiologists, came out with some new guidelines. And for the first time, they're calling them the 24-hour movement guidelines, instead of just focusing on the short periods of exercise that we should try to do on a regular basis during the week. So for adults aged 18 to 64, as well as those 65 and over, we should all be trying to accumulate 150 minutes of moderate to vigorous, that's that MVPA, physical activity each week. And that accumulate is a key word because it doesn't need to be in long bouts of an hour or even 30 minutes. It can be in short 5 or 10-minute bouts, and you just need to accumulate it by the end of the week. And we'll talk a little bit more how you can go about that, because for some people, that's actually quite a big leap from what you're currently doing. Strength training only needs to be done twice a week. Now, when we work with people in our clinic who have real weakness in some of their muscles, or they've maybe had a recent joint replacement surgery, we try to aim for 3 times a week because that will help that much more. But it's a minimum of twice a week that you need to do if you want to maintain strength. Our sedentary time that we spend sitting, they recommend we limit it to 8 hours or less a day. Now, that may sound like a lot, but I'm going to challenge you to actually think about how much time in your 24-hour day you do spend sitting. For those who are 65 and older, they also encourage doing regular balance activities because we are at higher fall risk. And if we don't have strong bones or good bone health, we are also obviously at higher risk of sustaining an injury or a fracture. And they recommend 7 to 8 hours of sleep at night for over 65 and 7 to 9 hours of sleep if you're under 65. So this pie chart here is how they want us to think about our day now. So you can see the moderate activity, which is this 150 minutes a week. If you spread it out over the week, that's about 30 minutes a day. So that's a very small slice of the pie in a 24-hour day. The blue is sleep. So there's our 8 hours of sleep a night. That they're the yet sort of lighter yellowy orange is sedentary time. So they recommend no more than 8 hours. So there's 8 hours there. And then you have all this light activity time in orange. And by light activity, I mean things like puttering around the house, taking your dog for a walk. If it's like my dog, it's a very slow walk with multiple pauses. Cooking, doing your dishes, dusting, doing laundry, but maybe not the carrying it up the stairs part. So just light activity. You might breathe a little bit faster, but you wouldn't consider it aerobic exercise. But that's what they're encouraging us to really look at now, is how much light activity and how often do we break up our day? Because if you were to draw a circle for yourself and put in your slices of the pie, you might be surprised by how big this sedentary time is. So that's your homework, is to, when you're done today, is to draw a circle and see how your day sort of is split up, and we'll talk a little bit more why that's valuable to do. So I think the take-home message is going to be move more, sit less. And all Canadian guidelines, all international guidelines recommend physical activity and exercise for people with arthritis. It is strongly recommended to help people optimize their physical activity and minimize their sedentary activity. Physical activity should be offered, people with arthritis should be offered information about physical activity and exercise, and they should be offered support to help them towards these goals. And that should be standard care. And that should be standard care from your family doctor, a rheumatologist, your physiotherapist. People with arthritis should also receive very specific, individually tailored programs with professional guidance if necessary. So not a generic take-home exercise sheet that says, here, these are the top 10 arthritis exercises, go ahead and do them. Actually tailored to what your needs are, what your challenges are, whether it's muscle weakness or poor balance or a really stiff joint. That's what we mean by tailored programs. So what are some helpful exercises for arthritis? So we talked about range of motion, and that should be done daily if you have affected joints. So I'm going to use the knee as an example because it's so commonly affected. If you have arthritis in your knee, whether it's from osteoarthritis or rheumatoid arthritis, you should try to move it through its full available range of motion every day. In fact, some people do it 2 or 3 times a day, just 5 or 10 movements. Some people with rheumatoid arthritis actually find that's helpful also to do in the middle of the night. If they wake up with pain or stiffness, or they just wake up, they will just, bend their knee up and down in the bed 5 to 10 times just to loosen it up, and that helps them to fall back to sleep. Stretching or flexibility exercises are for the muscles and tendons that cross the joint. So rather than doing 5 to 10 of them in sort of a rhythmic fashion, you actually do maybe anywhere from 1 to 3 stretches, and you hold those stretches for about 30 seconds or longer if you can tolerate it. Sometimes a joint may feel stiff, or you don't feel like you have full movement in the joint, not because there's any problem in the joint itself, but the muscles that cross the joint are shortened up or stiffer, and they don't allow that joint to move fully. So any muscles that cross a joint that's affected, that is painful, that maybe you're protecting a bit or it's swollen, you should also aim to try to stretch those on a daily basis. Strengthening exercises, also called resistance training. You will call the guidelines recommended twice a week. So we do usually up that to 3 times a week when someone is really trying to build up strength. And we again target the muscles that support and move the affected joint. And I'm going to show you on the next slide what some of those would be for the knee joint. Aerobic exercise or cardiovascular exercise, they recommend doing that at a moderate intensity, and as I said, accumulating 150 minutes a week. So moderate intensity is anything that just gets your heart rate beating a bit faster, it gets you breathing harder, you often feel a bit warm, but you can still talk. So talk while you walk. It's often called the talk test. So you're walking fairly vigorously, but you can still have a conversation with a friend. And with aerobic exercises, you want to choose activities that don't stress the affected joint. So often that means lower impact or avoiding twisting movements, things that can put strain through the cartilage. And there's so many great aerobic options that don't put the strain on the joints. And then finally, even if you're not over 65, if you have arthritis in any of your leg joints, including your low back, your balance and coordination can be affected. And that can be because of the swelling. It can be just from the pain itself. It can be changes to the joint surfaces where we have a number of little receptors in the joint that feed back information to our brain and said, you're standing up, you're moving, you're twisting. It gives us constant feedback as to what position we're in and our orientation. And those can all be impacted by arthritis. So doing balance and coordination exercises 3 to 5 times a week is recommended. So let's just wrap up with this before we go to a little movement break. So if your knee is the affected joints, what does all of this mean? So a range of motion exercise may be sitting like this or lying flat on your back and pulling your knee up towards your chest. You're trying to bend this knee. So you'd bend it up as far as you can, and then you'd slide it out, similar to what this this person's other leg is like. And you do that about 5 to 10 times. You don't need to hold it. You don't need to do it fast. You don't need to add any resistance. In this case, she's using a band or a towel to actually assist the movement to get a little bit more bend out of it. This would be a typical strengthening exercise that we would give to someone who has arthritis in their knee. This strengthening exercise is called a wall slide. It might be familiar to some of you. You slide down the wall, which makes your quadricep muscles on the front of your thigh work hard, as well as your bottom, your buttock muscles. And they too are really important when you have arthritis in your hips and your knees. Sometimes they place a ball behind the person's back to make it a little bit more unstable. And sometimes this exercise isn't appropriate. It actually is puts too much load on the knee, and we need to back off and start with an easier one. A good example of aerobic exercise for someone with arthritis in the knee would be pole walking. So in this case, this person's using 2 walking poles with what we'd probably call cane tips. So walking poles can either have a little booty or they can have a cane tip. And on tip, depending on whether you're trying to unload a knee or hip joint, or you're trying to just get a good aerobic workout, you would use a different tip and a slightly different technique. So pole walking has been shown to be safe and effective for people with knee arthritis. And while it doesn't unload the knee as much as a cane does, it does improve your stability and take a little bit of stress off the knee. Static balance exercises. So there's static balance when you're standing still and you're trying to maintain that position. And then there's dynamic balance. And that's when you're walking and having to step over objects and turn corners and maybe turn your head to the side. So both are important types of balance exercises. In this case, this person is just practicing standing on one foot. A more advanced version may be to have this person close their eyes and see if they can really get the foot and the knee on that standing leg to do its work and give feedback to the rest of the body. And then finally, a stretching exercise. Often at the end of an exercise program, when the muscles are warm, that's the best time to stretch. So for someone who has knee osteoarthritis, this person is stretching their hamstrings. So sitting at the front of the chair, putting out the legs straight. Sometimes they need to put it on a little footstool here, and that may help. And then bending forward, sort of hinging at the hip joint until you feel a gentle pull. Doesn't have to hurt, shouldn't hurt. Doesn't have to feel like a strong pull, just a gentle tension or pull in the back of the thigh. And they would hold that for 30 seconds and maybe do it 2 or 3 times. So those are some examples of exercises for someone with arthritis of the knee. And I think we'll take a little movement break here now. So I'm going to stop sharing. And this is a good time to break up our sedentary behavior.
Perfect. Thank you so much, Mary, for guiding us. And that is the educational part of how we can actually prevent pains and arthritis. And also combining that with exercise is very important, as we do at Choose to Move programs. So if you are joining me, my name is Eda. I'm the founder of Quantum Care and also an activity coach for the Choose to Move program. If you are joining me, you can have a scarf or a towel nearby. And everything that I'm offering is a suggestion. And the only requirement is that you keep breathing and taking care of yourself. As Marie said, everybody is different. So some of the movements may not be suitable for you. But if you are joining me, please take care of yourself and try not to push too much, but try to enjoy it. And if you are coming, let's find a seat of your choice where your spine is nice and long. And if you have any injuries where this is not possible for you, please take care of yourself. And if possible, have both of your feet on the ground. And we'll start with gentle breaths. You can close your eyes or just lower your gaze just to connect with our breath and our bodies. Let's have an inhale from the nose. And exhale it out of your mouth. Let's bring that oxygen in, into our joints, into our bones and muscles. And exhale, relax. Inhale. And exhale. We'll begin with our hands. As those of us who are experiencing arthritis may feel a lot of stiffness in the morning or throughout the day, for also those of us who are not moving as much or feeling where we have stiffness just throughout the day. Let's have just gently closing your fist and opening them. Open and open your fingers. Inhale, close and exhale, open. You can always engage your arms. Inhale and exhale. Beautiful. Inhale and exhale. You can gently rotate your wrists to one side. Again, the range of motion is up to you. You can start slow and small and gentle. And then, if possible, let's lengthen your arm parallel to the ground and flip your hand where your fingers are facing towards the sky and just gently hold with your left hand. And just bring your fingers towards your arm just a little bit and keep inhaling. Relax your shoulder. And exhale. Inhale. And exhale. Just bring your focus to this present moment. Inhale one more time. And exhale. You can flip your hand. You can take a rest. And then you can bring the outside of your hand while you're pulling with the left hand, just a gentle hold. Again, relax the shoulders, pull it towards yourself. Keep breathing. And just also saying hi to our bodies as we are moving the synovial fluid, which is the joint fluid, and relax. Shake those hands and let's move to the other side. Again, I'm holding my fingers with my right hand, very gentle. Inhale and exhale. And those of us also on our keyboards, this is a really great opportunity for us to stretch our wrists as they don't get enough stretch. And let's flip the hand. Outer hand is being held and pulled towards the body very, very gently. Keep breathing as much as you can. There's no right or wrong. If you are feeling couple seconds works for you, that's perfect. Let's shake those hands and let's give yourself a gentle massage. Self-massage is very, very supportive when we feel the joint pains, and it also warms the joints and the muscles. So just give yourself a gentle massage. And maybe your arm. Maybe the other arm, your shoulder, and let's rotate our shoulders. Inhale forward and up, and exhale back and down. Inhale forward and up, and exhale back and down. Inhale, and as much as you like, you can articulate this movement for your needs. So make sure your shoulder blades are feeling this movement. You can squeeze it as you move your shoulders back and down. Inhale and exhale. Beautiful. And if you are sitting, if possible, just as if you are walking, and just lift your arms. It can be just a little bit of lift or higher lift. Just again, warming up our joints and feeling, yes. And let's come on to our neck. It's a gentle part of our body. Let's try to be very, very gentle and slow. Bring the chin towards the chest and allow the back of your head to get a little bit heavy. And then you can move the head towards the left shoulder, where your left ear is close to the left shoulder, and the shoulder is not coming up. Ideally, just bring, and if you feel that nice stretch on the right side of your neck, you can give yourself a gentle massage, help those muscles to warm up. And as you exhale, bring the chin towards the chest, allow the spine to settle, and with your inhale, bring the head to the right shoulder. Again, the right ear is close to the right shoulder, shoulder is not coming up, and feel that stretch. If there is a tightness, maybe a little bit of pain, breathe into it, and you can again activate the self massage. And exhale, come to the center. And you can, with your inhale, look towards the right. Now try not to force your head towards the back too much. And then exhale, bring your head to the center. And with your inhale, look towards the left. And really look towards the left. And this is also an opportunity for us to stretch our eyeball muscles. And as you exhale, come to the center. Beautiful. And if you are sitting on a chair, you can just move a little bit forward. And we are going to just do a gentle cat cow while we are sitting. So with your inhale, you can roll the shoulders back, look up. And as you exhale, slide your hands and look towards the belly button and round your back if possible. And see how your low back, mid back, upper back are moving. Inhale, look up. And as you exhale, look towards the belly button, nice and gentle. Inhale, look up, roll your shoulders back. And exhale, look towards the belly button and kind of pucker your back. And maybe you stay here, move side to side, see how it feels. And with your inhale, come here. And you can again move the right shoulder forward, left shoulder back, and vice versa. Beautiful. And now you can have your scarf or your towel under your foot, under your thigh, or you can hold your thigh, or you can interlace your hands around the knee and just gently rotate your ankles and try to have your spine nice and long. Yes. Keep breathing. And feel this IT band, your outer side of your hip is nicely stretching. And then exhale, put it down. And let's lift the other one again. You can support it with the scarf or towel under. You can do this laying down. And you can have your hand under or interlace your hand. Again, let's have a nice back, strong and tall. Belly button in and bring that core engagement as you are rotating. And you can do these movements anywhere, anytime. If you are sitting on your couch, if you are at a doctor's appointment, even on the bus or while you are waiting for the bus. Yeah, let's few more. Engage your toes, and as you exhale, bring it back. And if you are sitting on a chair, let's turn towards the left. And just about we are coming to an end. And then right knee comes a little bit down, down towards the earth. And you can kind of see this part of your front side of your hip is nicely stretching. You see your range of motion, and the left leg is 90-degree angle, and this is great. And for some of you, you may be able to hold ankle or hold your clothes, or again with a strap, you would be able to help yourself. And just gently, as we sit, this muscle gets really stiff and constricted. So let's open that. And one more inhale here. And as you exhale, gently come up. And let's turn towards the right. And we are going to bring that left knee down towards the earth. And you can have your foot either nice and flexed or the other way around. So you see
And
what works best.
And
Yes.
I wonder if folks can just finish up this last exercise so
Perfect.
we can return over
Yes.
to Marie's final few slides.
Perfect. Yes. Just the other side. Try to also move and help your front side of your thigh. And as you are watching also, Marie, we encourage you to take care of yourself and move in the best way you can. Thank you so much.
Thank you so much, Edda. I know I feel much better and all that synovial fluid is moving around. Definitely a great visual. Thank you both. Back to you, Marie.
That was really nice. I quite enjoyed that little break. And Edda showed you some really good exercises that we consider sort of gentle range of motion and stretching. And as she said, you can do them anywhere. The more time you can break up your sitting still, even if you don't get out of your chair, all those exercises were done sitting. There's tremendous value in that. So I encourage you to try some of those exercises. Okay. Having said that, though, sometimes it's just hard to get started, or it's hard. You've done the program, say you've done the Choose to Move program maybe a year ago. And while it shows some really nice sort of long-term benefits to having done it, sometimes we get a little derailed, or we get sick, or this thing called COVID happens, or we travel and we just get out of our routine and we find all sorts of darn good reasons and excuses and barriers to getting physically active again. For people with arthritis, there's some really obviously very legitimate reasons why you may be hesitant to get started on an exercise program or do something more regularly. There's pain for some people on a daily basis, and there could be disease activity, and there could be fear of making that pain and disease activity, or maybe even damage that has happened, worse by doing exercise. And certainly the wrong exercise is done too often, too hard, inappropriately, can worsen someone's joint pain and can even lead to injury. So the right type of exercises are really important to do. A lot of people with arthritis, whether it's systemic arthritis like rheumatoid arthritis or spondylitis, even osteoarthritis, can experience a lot of fatigue. So here we are asking people to be more active and do exercise, but you're already exhausted during the day. But as I said, the research shows, and patients have told me over the years, once they get through some of those barriers of fatigue and build it up in gradual little increments, they actually start to get better control over their fatigue and they have more energy. Sometimes it's a matter of not knowing where to start, and you might need some guidance or support. So again, just being handed a generic exercise sheet from a doctor or any health professional and saying, here's some tips, or you should go be more physically active, is not always helpful. You need to know where you're at and find the right place and the right resources to help you get started and make a move from where you're at. And I'll share some of those with you. Sometimes we just don't have the motivation. We're tired, we're busy, we have other things on our plate. It's Christmas and holiday season coming up, so we've already got a lot on the go and we just don't feel very motivated. And there are a lot of nice resources, and the Choose to Move program is an example of one that uses activity coaching and sort of behavior modification or behavior change strategies to actually help people find their motivation and find a way to build more physical activity into their life. Might just be a lack of knowledge. It's like, okay, I know I should exercise. I hear that it's good for me. I'm ready to go, but what should I do? Which exercises? How much? How often? And that's where those physical activity guidelines and those 24-hour movement guidelines are a nice starting place. You may be getting inconsistent or even a lack of information from the health professionals you see. I still hear from clients that I see that their doctor said, actually, I should back off my exercise, or I should avoid doing more physical activity. I should rest my joint. They're getting mixed messages from us in healthcare. And it can be very confusing to people. So a lot of the work I do is actually to educate family physicians and rheumatologists and other health professionals around the importance of us all giving the same information and the same message. There can be costs associated with joining an exercise program, and there could be challenges with just accessing an appropriate program in your community. So where do you start? As I suggested, when you're done with this webinar today, take a glass, draw a circle, or freehand a circle and fill out your 24-hour movement clock. and see where you're doing well. Maybe you're getting the right amount of sleep. Maybe you're getting limited amount of sedentary time, but see where it is that you might need to make a difference or a challenge, and start there. Don't think you're going to start from doing very little moderate intensity exercise to suddenly meeting the 150-minute a week guideline. That's not realistic. I don't always meet that. And anyone who's, if you've been sick, or as I said, or traveled in that, often we fall right back and default back to kind of our baseline, and you have to work up to it again. So start at where you're at and go slow. Set realistic goals. Is it that you want to sit less? Is it that you want to move like some of the exercises like Etta showed us? Do you want to just learn to sort of break up your sitting while watching television shows? It's easy enough just to take a break on the commercial and stand up and do some light stretching. Is it walking you want to do more, or is balance your big issue because you're concerned about falling? So pick 1 or 2 goals and be realistic. And if you need to, talk to a health professional or an exercise professional to set those goals and get some guidance. Build on things that you're already interested in. Maybe you already have experience in it. It's your preference. Maybe you're someone who likes to exercise with other people. Maybe you're not. Maybe you'd rather do something at home or on your own. Maybe you're someone who, I'll exercise, but only if I get to be outdoors. I don't want to be stuck in a gym or in my home. Whereas others, because of the weather we're having currently here in Vancouver, exercising outdoors may not be a good option. In fact, it might be unsafe right now because of all the ice. If you anticipate that there may be some of those barriers that I showed you on the previous slide, or you even have some of your own unique barriers, think about how they might pop up as you get started on your exercise and problem solve ahead of time. And an example I often use is that you walk with a friend or a neighbor down the street 3 times a week, but one day your neighbor can't go. And the big part of the walk is the socializing, even though you both walk at a good pace in that. So what are you going to do if all of a sudden your neighbor can't go, or a class is canceled, or you can't get a drive to the exercise program? Think ahead and problem solve in advance. Have a backup plan. This was my day and my time for me to be active and to exercise. So what can I do without my neighbor? Can I find someone else? Can I do an exercise online, or in my watching a video, or in my home? Or am I okay to walk by myself that day? Track and monitor your activity. Reward yourself when you see small changes in your physical activity level. That can be as simple as carrying your smartphone around with you, which has step counts on it. Or just putting a check mark on your calendar to say, yes, I walked today, or I did my 5 exercises today, and just track and see how what kind of difference it makes when you see that you're starting to exercise more regularly. Find a friend or family member. The research shows that when you have social support, you're more likely to continue your exercise efforts and have fun. If it's boring and tedious, you're not going to stick with it. None of us would. So the key is to really nudge yourself along this physical activity continuum. So I kind of conceptualize this as what people 40 to 50 years ago living with arthritis could very easily be bedridden. They were encouraged to stay in bed. They were told to rest. And other than really basic, bed exercises, they were actually discouraged from getting up and trying to be active. They thought that would help to control the arthritis. We know so much better now. And at the other end of the physical activity continuum is someone who's an elite athlete or a marathon runner. In this sort of green zone here, this is where you'd be meeting those physical activity guidelines of about 150 minutes a week. And this person would be in excess of 300 or 500 minutes a week, obviously. So if you're starting down here with doing very little or no exercise, what we might call a couch potato, and doing minimal sort of day-to-day activities of daily living, it's not realistic to think you're all of a sudden going to, over the next few weeks, jump up into this exercise area. The key is just to nudge yourself a little ways along, get some movement in, get a little bit of exercise in, break up your sedentary time. And that's a fantastic place to start. And if you need guidance and support to do this, talk to your doctor or your physiotherapist. Look for some supervised programs such as the Choose to Move program, the GLAD program, which I'll show you on the next slide, the Osteoarthritis Service Integration System, or OASIS, for people with osteoarthritis, has a number of programs, which they're resuming now in person as well, including pole walking workshops if you feel like you need to be shown how to do it and not just read about it. There's also the 811 or HealthLink BC service, and they have qualified exercise professionals who can help you to find programs and give you advice on exercise. And if you feel like you need to talk to a physiotherapist specifically, try to find someone who has some experience in treating arthritis, and I'll talk just a bit more about that. So some community-based programs, you're very familiar with the Choose to Move program, and it's available throughout BC, and it's a fantastic supported activity coach program that involves finding activities that you choose to do yourself, and finding ways to overcome sort of barriers to exercise. And through the YMCA, they also have some structured programs that are available. The GLAD stands for Good Living with Arthritis Denmark, but this is GLAD Canada. And it is a exercise program for people with hip and knee osteoarthritis from early to late osteoarthritis. Even people who are waiting for hip and knee replacement sometimes take this class. And it's run out of mostly physiotherapy clinics. And it's available in, I think, over 55 clinics throughout BC right now. It's also offered at the UBC student-led clinic, and that's actually a cheaper option because the GLAD programs, since they're led by physiotherapists, are not cheap. They can be in excess of $500 for a 12-week program. But I encourage you to take a look at that website and look for a GLAD program that's near you if you'd like to try something. It is a very good program, and they're getting fantastic results. The ABC Fitness is all bodies fitness program out of Hillcrest Community Center. So good for people in the Vancouver area. And actually the therapists from Oasis and the educators from that program actually come and do some of the education for the ABC Fitness program. And then of course, you can always check your local community and recreation centers. There's, joint replacement specific programs in Richmond and the North Shore. There's a healthy hips and knees program at the Okanagan YMCA. There's range of motion classes, gentle pool exercise classes, and a lot of community center. And on our website, the Mary Pack Arthritis Program, we have a list of arthritis-friendly pool classes that we keep updating as COVID has affected, obviously, the programming over the last couple of years, but we try to keep updating it as pools resume. So I encourage you to take a look there for some ideas as well. And if you need some therapeutic resources, there is the Mary Pack Arthritis Program. We see people with inflammatory forms of arthritis or complex osteoarthritis. And we have 4 clinics in the province, on the island, and a couple in the Okanagan. I've mentioned the Oasis program. There's a number of hospitals throughout BC that still have arthritis services available through their outpatient departments. They are getting fewer and fewer, unfortunately. But Richmond has a program, Lionsgate Hospital, Burnaby and Surrey. In the Fraser Health Authority, they both have programs for people with inflammatory arthritis. And again, check with your local hospitals to see if they have an arthritis program, because then that is publicly funded and would be free physiotherapy. And then, of course, you can go to the Physiotherapy Association website and click on Find a Physio. You can put in where you live, how far you're willing to travel, some keywords like you could put in rheumatoid arthritis or knee osteoarthritis like I did here, and what areas of practice you're looking for. And then that would give you a list of the name of the therapists who treat people with arthritis and live near you. And then these are just some online resources. And again, you'll have the PDF of this, so you'll be able to check these out. And I encourage you to take a look at these resources and see what's available there. And these are just a couple other ways that you can learn a bit more about your arthritis by signing up for some newsletters, through some patient advocacy groups, or even participate in research studies if you're interested in learning more that way by being an active participant. And I think we'll stop there for questions.
Wow. Well, thank you so much, Marie, and to Etta again for the movement break. Marie, that was a really informative webinar. You covered a lot of territory, and we only have a minute left for questions. So I wonder if we could find a creative way to address some of the questions that came up in the chat, and also were sent in, just to be respectful of everybody's time and to end on time. So that's a commitment from us to get back to you on some of those questions in a creative way. So stay tuned in your inbox. And Marie, I just want to say a huge thank you for covering that that complex topic of arthritis, the various forms of arthritis and the benefits of physical activity. And you certainly drove home the core messages and function of Choose to Move, to keep active and to do it socially, to address those barriers that get in the way, and to manage, your journey. I love that diagram at the end there, to manage your journey towards a more active lifestyle in an incremental way, and building up those supports as you need. So thank you again, and for all those resources. We'll post this video within a few days on our Move and Connect webinar page on the Active Aging Society website. Choose to Move programs are located across BC, and I tossed up the link there in the chat. If you're keen to make your New Year's resolution early, we'll include those resources shared in the chat post-webinar. And just wishing you a healthy, happy Tuesday afternoon, and looking forward to connecting in January with our 2023 Move and Connect webinars. Thanks again for joining, everyone. Bye for now.
Great.